The liquid facelift is the way to recapture youth, look natural, and not have to have surgery, basically. What happens as we age is our skull and our face, everything sort of collapses, and so the skin has no place to go but down. And so with the liquid facelift, it's like blowing the balloon back up. And wherever there's volume loss, we put volume back in, and therefore the skin gets pulled back up. In contrast to a surgical facelift where the skin is pulled and cut, you lose the normal, natural softness of the face that way. Women, especially when they have a facelift, they end up looking more like a man because the angles of the bones show up more, and that's not the way to make someone look more youthful. The way to make them more youthful is to provide the contours that you see in a child's face or a teenager's face. It's easy. It's no anesthesia, no risk of anesthesia. There's no cutting involved. It's just injecting different materials into the skin, depending on what we're trying to do. Where we're going, I'll use different products underneath the eyes, opposed to if I want to do bony volume replacement, I'll use other products for that. The one thing that I have access to is all of the fillers in the market, and I use them. It's almost like cooking. You know, if you want to make a curry, you got to have a little bit of curry and a little bit of garlic and, you know, some curcumin and whatever flavor you're trying to get to. I can do that with my fillers. For example, I'll use a lot of times the platelet-rich plasma in the forehead because it's a liquid, and it goes in very easily, and so I can bring the forehead out a little bit, which of course raises the eyes. When I'm using Radius and Artifil, I put those usually in bony areas like in the temporal fossa, back here in the mandibular angle. We can do chin augmentation. We fix noses. A lot of times you can lift the nose up a little bit by putting some filler in the nose. In the lips, we use only hyaluronic acid products. For the cheeks, I like to use Sculptra because that's good for volumizing large areas. It's a very natural look. Underneath the eyes, I usually use the hyaluronic acid products like Restylane, Juvederm, Perlane. Yesterday I had a woman come in and she's on Plavix. She cannot have surgery, that's all there is to it. The only option for her is to do the liquid facelift. So the benefit is there's no risk of anesthesia. It's immediate, pretty much, and it takes about an hour. There's very little pain involved. We have all sorts of more modalities to make sure people are very comfortable when we do this for them. So, and it actually costs less. You can get a better result with a liquid facelift, a more natural, youthful looking face for less money and much less risk.